If you've ever checked your blood sugar and felt confused about what those numbers really mean, you're not alone. And if you've ever been told your blood sugar is normal for your age, this video may completely change how you think about diabetes prevention forever, because one aspect of blood sugar is far more dangerous than most people realize, especially after 60. And focusing on the wrong measurement has quietly put millions of seniors at risk of irreversible damage. Let me make you a clear promise right away. By the end of this video, you'll understand which blood sugar measurement is actually dangerous for seniors, why it becomes more critical as we age, and how many people are falsely reassured by normal fasting glucose while real damage is already happening. This is not about fear, it's about precision, and precision saves lives. I'm Dr. Linda Harrison. For decades, I've worked with older adults who did everything right. They checked their blood sugar, they watched their diet, they followed doctor's orders. And yet, many still developed diabetic complications, nerve damage, vision loss, or sudden cardiovascular events. When we looked closer, the issue wasn't that they ignored their blood sugar, it was that they were monitoring the wrong measurement. And no one explained why that mattered. Before we go any further, I want to ask you something important. When you check your blood sugar, which measurement do you pay more attention to? Your fasting glucose or your after-meal levels? Most people instinctively focus on fasting glucose. They're told that's the baseline. And for younger adults, that can be sufficient. But aging changes the rules. Let me tell you about a patient named Margaret. Margaret was 71, careful about her diet, and very disciplined about her health. Every morning she checked her fasting blood sugar and proudly told me, "My fasting number is perfect." Her fasting glucose stayed in the normal range for years, but her post-meal blood sugar, the number after eating, had been slowly spiking higher, 160, 180, 200. Each time she was reassured that some fluctuation is normal, she was told until one morning Margaret was diagnosed with severe diabetic retinopathy that no one saw coming. Here's the uncomfortable truth. Blood sugar is not just one number at one time. It's a story about how your body processes glucose throughout the day. And one of those measurements tells that story much more clearly than the other, especially later in life. When you measure blood sugar, fasting glucose tells you what your levels are after 8 hours without food. It measures your baseline control. Post-meal glucose, also called postprandial glucose, measures how your body handles the sugar from actual food. It reveals how well your insulin is working in real time. For decades, both measurements were treated as equally important, but large long-term studies have shown that this balance shifts with age. In younger adults, elevated fasting glucose is strongly linked to diabetes risk. But as we get older, our bodies gradually lose insulin sensitivity. Cells become more resistant. When that happens, post-meal glucose spikes higher, while fasting glucose often stays relatively normal. This condition is called postprandial hyperglycemia, and it's extremely common in seniors. Here's the part many people miss. Elevated post-meal blood sugar is one of the strongest predictors of heart disease, stroke, and diabetic complications in older adults. Stronger than fasting glucose in some cases, stronger than cholesterol readings, and yet it's often minimized or dismissed as temporary fluctuation. Why does this happen? Because aging cells can't absorb glucose the way they used to. When you eat, blood sugar spikes higher and stays elevated longer. That excess glucose damages delicate blood vessels in the brain, kidneys, eyes, and nerves. Over time, this damage accumulates quietly. This is why diabetes is often called the silent disease. It doesn't fail loudly, it fails slowly, and post-meal glucose is usually the first warning sign. Now, here's an open loop I want you to hold on to. If post-meal glucose is so dangerous for seniors, why are so many people told their blood sugar is fine? The answer lies in misunderstanding what normal really means at different ages. Many seniors are told that a fasting glucose of 100 or even 110 is acceptable for your age. But research has consistently shown that sustained post-meal readings above 140 significantly increase the risk of cardiovascular disease and diabetic complications. Above 180, the risk rises sharply. Above 200, the danger accelerates. At the same time, there's another trap. Lowering blood sugar too aggressively can cause harm, especially if glucose drops too low. When blood sugar falls below about 70, the brain and organs may not receive enough energy. This can cause dizziness, confusion, shakiness, and increased risk of falls. In some cases, it can even trigger dangerous cardiac events. So now we have a dangerous balancing act. High post-meal glucose damages organs. Too low glucose starves the brain, and many seniors are caught in the middle without anyone explaining what's happening. This leads us to an important concept that almost no one talks about outside medical circles: glycemic variability. Glycemic variability is the swing between your lowest and highest blood sugar throughout the day. For example, if your blood sugar ranges from 90 to 190, your variability is 100 points. High glycemic variability is a sign of poor glucose control and increased cardiovascular risk. Many seniors have high glycemic variability without ever being told it matters. This is why someone with post-meal spikes to 180 may actually be at higher risk than someone with a fasting glucose of 115. The second reading looks worse to most people, but the first reflects glucose spikes and oxidative stress, which are especially dangerous in older adults. Here's where confusion deepens. Some people try to lower fasting glucose by adding medications that also cause dangerous low blood sugar episodes. They feel weak, shaky, confused. They assume it's aging when in reality, their blood sugar is being overcorrected in the wrong direction. This is why blood sugar management in seniors must be individualized. One-size-fits-all targets don't work. Numbers on paper matter, but how you feel matters too. Let me ask you another question. Have you ever felt unusually tired after meals or lightheaded between meals despite eating regularly? These can be signs that your glucose control has become unstable, even if your fasting numbers look acceptable. Now let's come back to the core question. Which measurement is actually dangerous? For most seniors, sustained high post-meal glucose is the primary threat. It increases the risk of heart disease, stroke, nerve damage, kidney disease, vision loss, and cognitive decline. Fasting glucose still matters, but its role changes with age. The goal is not to chase youthful numbers. The goal is to protect organs and maintain stability. Here's another open loop. If post-meal glucose is the main danger, why do some dietary changes lower fasting glucose but barely affect post-meal spikes? And what actually helps reduce glucose variability without causing dangerous lows? That's what we'll cover next. Because in part 2, I'm going to explain why post-meal glucose continues to rise even when fasting numbers look fine, what actually improves insulin sensitivity, which dietary strategies are backed by research, and why some diabetes medications help seniors while others quietly cause harm. Before we move on, I want you to remember this. Blood sugar problems rarely announce themselves. They don't cause immediate pain, they don't give obvious warnings, and the measurement most people ignore is often the one that matters most. Now let's talk about what actually helps, because understanding which measurement is dangerous is only useful if you know what to do about it. This is where many seniors feel frustrated. They're told their blood sugar is high, they're given medication, and yet they still don't feel quite right, or the numbers improve on paper, but weakness, fatigue, or brain fog appear instead. That's not success. That's imbalance. The first thing to understand is this. Post-meal glucose behaves differently than fasting glucose, and it responds to different strategies. Trying to control both measurements the same way often creates problems, especially later in life. Post-meal glucose is driven largely by insulin resistance. As cells age, they become less responsive to insulin. They no longer absorb glucose efficiently with each meal. This causes blood sugar to spike higher after eating. That's why post-meal glucose continues to rise with age, even in people who eat carefully, stay active, and feel generally healthy. This also explains something many seniors find confusing. You can feel perfectly fine and still have dangerously high post-meal glucose. There may be no warning signs, no symptoms, no discomfort. That's why relying on how you feel alone can be misleading. One of the most effective ways to influence post-meal glucose is improving insulin sensitivity. That means reducing inflammation, improving cellular function, and lowering excess glucose load on the system. This is where lifestyle plays a powerful role, often more than people realize. Let's start with movement. You do not need intense exercise to help post-meal glucose. In fact, overly strenuous activity can sometimes disrupt glucose control temporarily. What research consistently shows is that gentle movement after meals, especially walking, dramatically improves glucose uptake and reduces post-meal spikes. Even 10 to 15 minutes of walking after eating can lower post-meal glucose by 20 to 30 points without causing dangerous lows. Walking also improves insulin sensitivity, reduces inflammation, and enhances cellular metabolism. All of these directly affect post-meal glucose. The key is timing, not intensity. Now let's talk about carbohydrates, one of the most misunderstood topics in blood sugar control. Some seniors are told to eliminate carbs completely. Others are told it doesn't matter as long as fasting glucose is normal. The truth is somewhere in between. In insulin-resistant individuals, refined carbohydrates can spike post-meal glucose dangerously high. But in older adults, over-restricting carbohydrates can cause muscle loss, fatigue, weakness, and unstable energy levels. This is especially true for those on certain medications. The goal is not zero carbs. The goal is choosing the right types. Whole foods with fiber behave very differently than processed foods with refined sugar. Replacing refined carbohydrates while maintaining adequate nutrition is often far more effective than extreme carb restriction. Meal composition itself is another overlooked factor. Many seniors eat carbohydrates alone, bread, fruit, juice without protein or fat. Unfortunately, this causes rapid glucose spikes and crashes, which raises average glucose levels over time. Combining protein and healthy fats with carbohydrates slows digestion and moderates glucose response. This simple change can reduce post-meal spikes significantly. Stress is another powerful driver of elevated glucose. Chronic stress triggers cortisol release, which raises blood sugar and reduces insulin sensitivity. Over time, this keeps post-meal glucose elevated even with careful eating. This is why relaxation techniques, adequate sleep, and stress management often lower glucose levels sometimes more effectively than medication adjustments. Now let's address medications honestly and carefully. Diabetes medications save lives, but not all medications work the same way, and not all are ideal for every senior. Some medications target post-meal glucose effectively while preventing dangerous lows. Others lower overall glucose sometimes too aggressively. One common issue in older adults is medication-induced hypoglycemia. When blood sugar drops too low, the brain, which depends entirely on glucose, may not receive adequate fuel. This can lead to confusion, falls, loss of consciousness, or even stroke-like symptoms, even though overall glucose control looks improved. This is why symptoms matter. If diabetes treatment leaves you shaky, confused, unusually hungry, sweating, or mentally foggy, those are not normal side effects to ignore. They may be signs that blood sugar is being lowered in the wrong way. This brings us to monitoring and how blood sugar should actually be tracked. Single fasting readings in the morning are often misleading. Meal content, activity level, and stress all affect glucose throughout the day. Post-meal readings taken correctly 2 hours after eating provide a much clearer picture. Testing after different types of meals is especially important because elevated post-meal glucose after certain foods reveals individual insulin resistance patterns. If your glucose spikes to 180 after pasta but stays at 120 after chicken and vegetables, that information is invaluable. Those patterns guide better food choices. Another important concept is trends, not single numbers. A gradual increase in post-meal spikes over months or years is far more concerning than an occasional high reading. That progressive rise reflects worsening insulin resistance and cellular aging. Now let's return to glycemic variability, because this concept ties everything together. Large swings between low and high glucose are a sign that your body is struggling to maintain stable control. Research has shown that high glycemic variability is associated with higher risk of heart disease, nerve damage, and cognitive decline in older adults. Yet most people are never told to look at it. For example, glucose that ranges from 80 to 200 throughout the day produces variability of 120, a red flag. Even if fasting glucose looks acceptable, the stress on blood vessels is significant. This is why treatment should aim to gently reduce post-meal spikes without causing dangerous lows. That balance is the goal. Now, here's something empowering. Small, steady changes often produce meaningful improvements over time. Better sleep, post-meal walks, improved meal composition, reduced stress, and proper hydration all work together to reduce glucose variability. None of these are dramatic, but combined, they can shift risk significantly. Another important factor is muscle mass. Loss of muscle increases insulin resistance and raises post-meal glucose. Even modest strength training can improve glucose uptake into cells. Sleep also deserves mention. Poor sleep disrupts glucose metabolism and raises post-meal levels. Improving sleep quality often lowers glucose spikes within weeks. At this point, I want to address a fear many seniors have. If my post-meal glucose is high, does that mean diabetes is inevitable? Not necessarily. Cells retain some ability to respond to insulin even later in life. While insulin resistance increases with age, it is not completely irreversible. Slowing progression matters, stabilizing numbers matters, preventing further damage matters. This is why glucose control is not about achieving a perfect reading once, it's about maintaining stability over time. Now let's bring this all together. For most seniors, post-meal glucose is the primary danger. Fasting glucose should not be used as the only measure. The swing between them tells an important story. Symptoms matter just as much as numbers. Blood sugar is not a pass-fail test. It's a communication tool. It tells you how your cells are handling glucose as you age. Let me be very clear about something. You should never stop or change medication without medical guidance, but you should absolutely understand what your measurements mean. Informed patients have better outcomes. Period. And this understanding can prevent unnecessary complications. Many seniors worry over slightly elevated fasting numbers while ignoring dangerous post-meal spikes. Others celebrate normal fasting readings without realizing insulin resistance is progressing. Knowledge corrects both mistakes. We've covered a lot. So let me leave you with the most important takeaway. Blood sugar danger in seniors is not about perfection. It's about protecting the brain, the nerves, and independence. It's about preventing heart attacks, vision loss, and sudden events that change lives overnight. And now I want to end with one clear question. This is your call to action. When you check your blood sugar, do you ever test after meals, or do you only check fasting levels? Write your answer in the comments, because the more you understand your patterns, the less power they have over you, and the more control you regain over your health.